All right, so medical terminology basically is learning the parts of a word. So the root or the main part, an example of that would be cubit, which means elbow. A prefix are the part at the beginning. So example is ante, which means forward or before. Suffix or is meaning at the end. An example is all, meaning pertaining to. So if you put those all together, antecubital means area before the elbow. So examples of word roots, I will not read these to you as you can read, but I will point out the bottom one there where it says phlebo, which means vein, and that just kind of goes to, phlebotomy. For a prefix example, we can talk about post, which means after. So postprandial means after eating. And you can have prefixes as a number. So you can have tri, which means 3, so as in tricuspid valve. Metric fixes, you can also have those beginning. So deca means 10, so a decaliter. So make sure you know these as they are important sometimes. Kilo, 1,000, so a kilogram. You can also have a prefix for color. So if you look at like ruby for red, so rubella, or melano means black, so melanoma, or leuco means white for leukocyte, which is a white blood cell. Suffix, so you can have itis, which means inflammation, so arthritis. You can also have oma, which is like a tumor or a growth, so hematoma. And then you can combine vowels. So combining vowels are added to make the pronunciation easier. So example, leuc means white, cyte means cell, and we put the O in the middle to make it a little bit easier to say. So leukocyte instead of leukocyte. They are not usually used when the suffix begins with a vowel. So example, leuc and then emia. So to put those together, it's leukemia. We don't really need an O or anything in between there because it already has that vowel. Spelling changes, so roots can change their spelling when they are combined with different suffixes. So example is erythemia, means redness of skin. This is a modified version of the root erythro, which means red. Plurals are formed by changing the end of the word rather than adding an S. So ovum becomes ova, which is an egg, and nucleus becomes nucleoli. There are additional plurals that may be out there that you will see, so make sure you take a look at those. Translating into appropriate medical forms, so make sure you memorize some of the most common roots. So those would be the ones in your textbook. They're also the ones that were listed earlier in this presentation as well. Remember simple guidelines about plurals, combining vowels and other tips. And keep a medical dictionary handy. They will often have tables of the word roots, and that kind of helps you put together what you're looking at or looking for. Use selected medical terms and expressions, so make sure you combine knowledge of prefixes of word roots combining vowels and suffixes. So example, hematology. So if we break that down, we have hematit, which is the root, which means blood. O, which is going to be that combining vowel that we talked about. And logi, which is the study of, or the suffix is the end of the word. So we have hematology, which is the study of blood. Define and use medical terms applicable to phlebotomy, so make sure that we can combine those words as well. Again, these are found in your textbook, so an example of this would be venipuncture. We can break this down into ven, which is root, which means vein, I, which is going to be that combining vowel, and then puncture, which is actually the end of the word or the suffix, and that means to draw blood from. So we're going to draw blood from the vein, which is venipuncture. Abbreviations. In most cases, a particular abbreviation has only one widely used meaning in the medical field. So some abbreviations are content specific. So an example for phlebotomy would be, well, in medical at least, AE could mean above elbow. but to a phlebotomist, but adverse effects to a pharmacist. So abbreviations are commonly used in the medical field, but they probably really shouldn't be, just because there can be some miscommunication with those. Common healthcare abbreviations that you may see, especially in the lab, you may see BX for biopsy. You could see AC, which means before meals, and ASAP. You'll see that a lot, and that means as soon as possible. Another one you may see a lot is DOB, or date of birth, and DX, which is diagnosis. Another one you may see a lot of is ER, for emergency room. You may also see a lot of like NPO, so nothing by mouth. So sometimes you'll see that if you're putting in lab orders, the doctor may put, NPO, or if you're in the lab drawing blood up in the hospital, it may say NPO by the patient, and that means they can't have anything, even if the patient's asking you for some water. Generally, what I recommend to do is ask the nurse if the patients are asking for anything, because we don't know what their care looks like. Another example that we would see a lot of is PRN, so that just means as required. Another one we will see a lot of is STAT, and that means immediately. Abbreviations that should not be used. So these are kind of the official do not use list in the medical field. So the Joint Commission has actually recommended to avoid these abbreviations. So I'll let you go ahead and take a look at those.